Hi, my name is Oscar Zambrano and I'm going to talk about triple CFTR modulator therapy for cystic fibrosis. Definition: cystic fibrosis is a progressive genetic disease that causes persistent lung infection and limits the ability to breathe over time. In people with CF, mutation in the cystic fibrosis transmembrane conductance regulator gene cause the CFTR protein to become dysfunctional.
Your lungs, you have the bronchial tree. This carries airflow back and forth. In people with CF, the lungs contain long, thick and sticky strands of sputum. This clogs your lungs and becomes an ideal home for bugs. Dornase alpha, also called DNase and pulmozyme, helps you to get rid of the sputum. When taken regularly, DNase will chop up the thick strands of sputum into smaller pieces, making it easier for your lungs to clear. DNase is a subtle helper. It doesn't make you cough a lot, and you probably won't feel any immediate difference, but throughout the day, you'll be clearing and swallowing small amounts of sputum as your body moves it away from your lungs into your mouth. Over time, this helps to keep your lungs healthy and protect your lung function. If you don't take your DNase regularly, then the amount of sticky sputum may increase and become too much for the treatment to clear properly. If sputum sits there, then infections are more likely, and that can result in damage to your lungs. So remember, you may not feel DNase working, but it's doing its job.
Cystic fibrosis, or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called a bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath. As the disease progresses, long-term damage can occur in your lungs. This happens when germs, like bacteria, get into your lungs and cause chronic infections and inflammation. But there's a lot you can do to control the infections and slow the progression of lung damage. Talk to your CFTR team about how the different parts of your treatment plan can help keep you healthier. As your partner, they can help you find ways to fit your treatments into your daily care routine.
Application in medicine. The CFTR gene provides instruction for making a protein called the cystic fibrosis transmembrane conductance regulator. This protein functions as a channel across the membrane of cells that produce mucus, sweat, saliva, tears, and digestive enzymes. The CFTR protein also regulates the function of other channels, such as those that transport positively charged particles called sodium ions across cell membranes. These channels are necessary for the normal function of organs such as the lung and pancreas.
we draw bacteria and other microorganisms into our lungs. Our airways are lined with airway surface liquid, or ASL, composed of periciliary liquid and mucus that traps debris. Hair-like structures called cilia sweep ASL, clearing debris and protecting against obstruction, infection, and inflammation. A protein called cystic fibrosis transmembrane conductance regulator, or CFTR, lines the apical membrane of epithelial cells and transports chloride into ASL. Chloride and sodium in ASL attract water. In patients with cystic fibrosis, various CFTR mutations impair chloride transport, causing sodium and water to leave ASL, thus dehydrating airway mucus. The dehydrated mucus flattens cilia and creates an environment suitable for obstruction, infection, and inflammation.
Pros and cons. Pros. People who undergo treatment have better quality of life living more than 40 years, something that was impossible before. Cons. It's likely that, as they are having results of this and other new molecules, it is necessary a molecule or combination of these according to the mutation or existing in each patient.
The first CFTR modulator that was approved for people with cystic fibrosis was ivacaftor, also known as Kalydeco. This treatment alone helps people who have one of 10 genetic mutations that are seen in about 8% of people with CF. Ivacaftor lumacaftor, also known as Orkambi, is a drug combination that treats people with 2 copies of the F508del mutation, which is seen in about 48% of people with CF. Researchers are looking for ways to improve the performance of CFTR modulators for all people with just 1 copy of F508del. This would cover an additional 38% of people with CF. Researchers are doing this by stabilizing the defective CFTR protein so it functions correctly. When making a normal CFTR protein, messenger RNA, the long strand at the bottom, holds the genetic code and gives instructions for how to make the protein. The round structure is called a ribosome, which reads the instructions from the RNA and assembles the CFTR protein. The protein is made up of building blocks called amino acids, and these form different structures called domains that fold together like a puzzle. Each of these domains has a different name, such as TMD1 and NBD2. All the domains fit together to form a functional CFTR protein, and the area where they fit together snugly is right where an amino acid building block called F508 is located. When the F508 building block is present, the protein folds properly and is moved to the cell surface, where it then functions as a chloride channel that balances salt and water at the surface of the cell. However, in people who have the F508del mutation in CF, the F508del amino acid building block is missing. The puzzle pieces no longer fit together properly, and CFTR is unable to make it to the cell surface to function as a chloride channel. New drugs are being developed to help fix the CFTR protein in people who have the F508del mutation. These drugs are known as correctors. They bind to the CFTR protein and help the puzzle pieces fit together properly. The first corrector that has been developed and approved by the FDA is lumacaftor. Researchers have found that adding a second corrector drug can even further stabilize CFTR. Once stabilized, the CFTR protein is ready to be moved or trafficked up to the cell surface and function as a chloride channel. Now, the corrected CFTR protein is being formed, then moved through the cell and up to the cell surface, where it can now function as a chloride channel. Once the corrector-treated CFTR reaches the cell surface, another drug known as a potentiator can be used to bind to the protein and further open up the chloride channel. The first FDA-approved potentiator drug was ivacaftor. Through corrector and potentiator drugs, the CFTR channel is now able to better function and restore a healthy balance of liquid on the airway surface.
Issue applied in Ecuador. CF, it has an incidence of 1 per 200, 2,500 to 600 newborns depending on the new region ethnic origin. In conclusion, the median predicted age of survival for people with CF is currently in the early 40s. Life expectancy is strongly affected by the severity of the disease, age of diagnosis, and the type of CF gene mutation. With routine therapies and healthful lifestyles, most people with CF can lead active lives. Well, that is all for me. I hope you like it. Thank you very much.